Hello, I'm Dr. Stephen Pike from the University of Michigan in the USA, and at this year's ISTH, I had the opportunity to present the preliminary results of the first-in-human gene therapy study using AAV-HU37 capsid vector technology in severe hemophilia A. This is a phase 1/2 study of BAY2599023, which I will call BAY259 for short, and the study is ongoing and sponsored by Bayer. BAY259 is a non-replicating AAV vector carrying a single-stranded DNA genome encoding a B-domain deleted factor VIII, and it's activated by a liver-specific transthyretin promoter enhancer combination. And this vector was developed to address a key challenge of AAV-mediated gene therapy, that being the high prevalence of neutralizing antibodies directed against the AAV capsid, which precludes as many as half of any interested patients from receiving this therapy. BAY259 is the only clinical stage gene therapy for Hem A that uses the AAV-HU37 serotype that was selected for a low neutralizing antibody prevalence and efficient liver-directed factor VIII gene transfer. This study enrolled men with severe hemophilia A into 3 escalating dose cohorts with at least 2 subjects per dose, and it started at 0.5 times 10 to the 13th vector genomes per kilogram, and then is escalating up to a potential 4th dose cohort at 4 times 10 to the 13th. We've had 8 subjects with data available from 12 weeks post-dosing for subject 8 and 100 weeks for subject 2. A dose response was observed with sustained factor VIII levels achieved over a time of up to more than 23 months with no evidence of loss of expression thus far. None of the patients have reported spontaneous bleeds requiring treatment once achieving protective levels of at least 11 IUs per deciliter were achieved. The safety data from this first gene transfer study using this vector indicate that BAY259 has a favorable safety profile. There were 5 adverse events of special interest, which were all elevations of the ALT enzyme. These elevations in ALT were observed in 1 patient in cohort 2 and then 3 patients in cohort 3, and a serious adverse event was observed in patient 8 within cohort 3. These elevations in liver enzymes are common in AAV-mediated gene transfer studies and are managed with corticosteroids. No other study drug-related adverse events or serious adverse events have been observed to date. So to summarize, BAY259 is the only clinical stage gene therapy for hemophilia A that uses the AAV-HU37 serotype selected for low neutralizing antibody prevalence in the community and efficient liver-directed factor VIII gene transfer. It's delivered early, measurable factor VIII expression that's been sustained over more than 23 months to date with hemostatic efficacy. And with ALT elevations that respond to corticosteroids, its safety profile has been assessed as favorable, such that as of May 17th, the DMC have recommended to continue with the study and open up the next higher dose cohort, cohort 4. So we can look forward to updates on this program at subsequent scientific meetings.